Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARS, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPARS partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARS, which is touted as one of the best natural ways of solving serious health problems.
PPARS stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARS, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARS is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARS is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature. Hi everyone, it's back to school season and all the parents out there, I'm sure you're both excited but also concerned about your kids going back to school, mingling with their fellow friends and students. So today, I've invited Dr. Jansen to give you important advice about sending kids back to school. Doc, how do the parents protect their kids?
Here are the things that we can do, okay? So we can do the things that we have always been doing for the past 2 years. Tell them to wear their mask and only remove them when they are eating and drinking or doing vigorous intensity exercise, okay, so that they don't suffocate. Okay, number 3 is to tell them to always wash their hands. Of course, more importantly is to get them vaccinated for flu and also for COVID-19. Okay, for COVID-19, Pfizer is the one that I would recommend. Okay, so aside from this, feed them a lot of fruits and vegetables, okay? Because here's the evidence that really a high amount of consumption of fruits and vegetables can do wonders for immune system. Okay, so aside from fruits and vegetables, again, exercise at least 60 minutes every day, and of course, sufficient sleep. Okay?
So it's good. Don't stop your kids from running around in school and playing with their friends, especially running, right? So let them exercise. Doc, important question for all the parents out there. I'm sure every parent would want to supplement their kids, even if they don't supplement themselves. They will buy like vitamin C syrup and things like that because they're sending their kids back to school, face-to-face contact with other students. Doc, as a doctor and a lifestyle specialist, how would you choose and how would you recommend parents go about supplementing their kids?
I would choose a whole food supplement. Okay, so by whole food, it means that the supplement that you're giving is in a whole food form, meaning it is unprocessed and unrefined. Fruits and vegetables, no, that was converted into a pill form. Okay?
So, because sometimes you just can't get your kids to eat their vegetable.
Yes, that's one thing. And of course, you want your supplement to have that antioxidant punch, no? So that you get the added protection.
So is antioxidants the only thing you look for? I mean, that's usually what people see when they get a vitamin C plus zinc syrup or things like that. What other functions do you look for in a supplement when it comes to the immune system?
It should have an immunomodulatory effect.
Wow, that's a big word, Doc.
Yes. So what does immunomodulatory means? So immunomodulatory means that it makes our immune system smart. When it needs to kill off bacteria, it is vicious. But when it needs to tone down or when it needs to calm down, then it calms down immediately. Okay, so what are the supplements out there that has an immunomodulatory property? Okay, beta-glucan.
Beta-glucan,
Yes,
okay.
beta-glucan is derived from mushrooms. So yeah, you can actually feed your kids mushrooms instead.
Yeah.
Okay, green leafy vegetables. Okay, your malunggay.
Oh, malunggay.
Yes.
So malunggay supplement would be a good
Yes,
choice.
it would be a good
Or
choice.
you could make your kids' favorite tinola.
Yes, you can just feed your kids malunggay. Okay, so I would rather choose something that I cannot still a whole food supplement, but something that I cannot get from a palengke.
Okay.
Okay, I cannot get from a market. Okay, that would be your microalgae. Okay, because microalgae, of course, you cannot just get it from the river, okay, or get it from the lake outright. You have to clean it. But microalgae are really
superfoods.
they are superfoods. They are packed with antioxidants. It has an immunomodulatory effects, and they are really good. Okay, and the taste is quite good actually. Yeah, it's quite good. Okay, so yeah, that's how I would choose the supplements.
And I would recommend Simply Nature PPAR tablets because we are clinically proven to be immunomodulators. So Doc, you for yourself and your kids, your future kids, you wouldn't just like get those isolated vitamins like vitamins, zinc, iron kind of thing. You would always advise a whole food supplement instead.
Yes.
Because in your whole food supplements, you have more than just the zinc, the vitamin C, the vitamin D, and the vitamin E. You have a lot of other good stuff. So with that, we wish you and your kids a great back to school season.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months, cancer-free. Dapat may food supplements kayo, like Simply Nature, na proven and tested ko na. Oh, talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, no? Basura. Started the tablet and then the powder.
The powder.
Tinry ko din yung yung tawag dito.
Gel?
Yeah,
Soft
yung gel.
gel?
Yes.
Yeah.
It's really good. After 2 months ng aking therapy and taking PPARS, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARS, ako po ay cancer-free.
is also the leading cause of death because of cancer, because of itself, no? Because of the cancer. Okay, once you get lung cancer, whether it's secondary or primary, then the prognosis is not really that good.
Hi everyone, welcome to another episode of Simply Heal. Our program is on every Thursday. We are one of the longest running cancer programs there are in maybe Asia Pacific.
Yeah, we already have more than 60 videos already, and the count is still going up.
Yeah, and what makes us, what our viewers like yourself, thank you for your support once again. What makes us popular is that we have a AMA segment, which is the Ask Me Anything, and it's so encouraging, especially for myself and Dr. Jansen, that you would bring your diagnosis to us, you will ask questions that maybe sometimes you feel uncomfortable to ask your own doctor. Or, doc, the very common effect is the questions come after we leave the office. It's like after you come home from the doctor's clinic, you're like, why didn't I ask this? Why didn't I ask that?
You forget some questions that you want to ask, so this is an opportunity for you.
So every Thursday we are here, and we are, no matter where we are. Sometimes I do it from Singapore. Sometimes Dr. Jansen will do it from overseas, maybe even Palawan sometimes. All right, and but we are here to always support you, to answer all your queries about anything medical, and especially cancer focus. So today's topic is one that is very important because we're going to talk about cancer which really kills.
Yes.
You know, so today's topic is lung cancer.
Yeah. Okay, so for lung cancer, we have again two types. No? So we have the primary lung cancer and we have the secondary lung cancer. So we're going to be discussing both, but I will be focusing more on the primary type of lung cancer. Okay, so for some statistics, okay, so lung cancer is the most common cancer worldwide.
Oh, I always thought it was breast.
Yeah, it's actually not. It's lungs.
Yeah, but you know, statistics always like breast, but wow, it's lung cancer.
This usually occurs in men aged 60 years and up. Okay, so why men? It's because more men smoke versus women. Okay, and of course, men usually do the dirty work, especially if you are a jeepney driver. If you work in the mines, you work in the factory. If you work in the kitchen, you inhale fumes, okay? It's always the men who are exposed to smoke, okay? Lung cancer is also the leading cause of death because of cancer, because of itself, no? Because of the cancer, okay? Once you get lung cancer, whether it's secondary or primary, then the prognosis is not really that good. Now let's move into more details. So, for primary lung cancer, there are a lot of types, but I will only be discussing the two major types. Okay, so the small cell lung cancer and the non-small cell lung cancer. Okay, so first, non-small cell lung cancer. Once you get diagnosed with non-small cell lung cancer, if it is localized, the 5-year survival rate is 64%.
Okay, still, so it's slightly better than 50-50 chance.
Because if you develop localized, especially if it's still in the early stages, then it's easy to just cut it out. Then you live. Okay, but if it spreads regionally, now what do I mean regional? If your lung cancer spreads to the adjacent lymph nodes, okay, if it invades your chest wall, okay, then your prognosis immediately drops to 37%.
Wow.
Okay, so that is a huge drop. Now, when your lung cancer metastasizes to other organs, your liver, your brain, okay, your kidneys as well, okay, so that your 5-year survival rate immediately drops to 8%. So it's almost like a death sentence already.
Wow, okay? And that's for the non-small cell.
That's for non-small cell.
And the next type is actually the small cell.
The small cell type is more lethal. It's more aggressive. If you have the localized small cell lung cancer, straight away, 29% survival rate, 5-year survival rate. Okay, regional, you get 18%. If it metastasizes, okay, lung cancer that metastasizes to elsewhere, 3%.
Wow,
survival.
It's almost a death sentence.
It's almost always a death sentence. Later, I will show you why.
And, and doc, for this, for example, if you get the unfortunate news of like regional or even distant spread of the cancer, how long would the 3% survival rate, how long would normally a lung cancer patient? What would the oncologist very likely tell them?
Usually it's 6 months.
6 months. Okay.
Usually it's 6 months. Okay, and that is when you are trying to fight for your life inside the hospital. Once you get discharged, then it's going to probably be shorter than. Right? So, just to give you an idea, no, for metastatic lung cancer, if you have a cancer elsewhere, let's say for example you have breast cancer and then your breast cancer metastasized to the lungs, the 5-year survival rate is 7%.
Wow.
Okay? That is already very low. So it's actually a dangerous sign for us doctors that once we encounter a patient that has
Cancer in the lungs,
in the breast that metastasized to the lungs, that is a danger sign that, hey,
gotta take
we have to
strong
either,
action.
Yeah, strong action. It might be, yeah, we might need strong action, or we might need to tell the patient already, hey, there's nothing anymore we can do. The prognosis is not good, so yeah. Okay. So next, lung cancer is actually curable, 80 to 90%.
Okay,
Back to
good
This
news.
is the good news.
Back to good
Okay,
news.
but
right?
there's a condition if it is caught early. Okay, because it's easily, you can easily cut out the diseased part of the lung, and you have a lot of lobes. I mean, the right lung has 3 lobes, the left lung has 2 lobes. Okay, if one lobe gets a tumor, you can easily remove that lobe and you'll still have a functioning lung.
Okay, so that's good news. Our lungs are very compartmentalized.
Yeah.
We can safely remove parts of the lungs.
But of course, if it is caught early, but if it becomes regional already, as you have seen in the previous slides, then the rate of curability drastically decreases and cancer becomes more advanced. No. Now, what are the signs and symptoms? So this is true for both small cell and non-small cell lung cancer. So that will be your persistent coughing. You're coughing up blood.
Wow.
There's
never
chest
a good
pain.
thing when you cough up blood.
Never a good thing when you cough up blood. But how do you know if it came from the lungs or it came from your stomach?
Yes, that's because some of us we vomit and
we vomit
scare
and
ourselves.
blood. You scare yourself, right?
Okay.
Now, what is the color of the blood that we're going to expect to see that comes out from the lungs? It's going to be bright red. Okay, that's why if you see a bright red blood, coughed out a bright red colored blood, then that blood must have come from your lungs. Okay?
Doctor, quick question, because now I'm scaring myself. I've coughed up bright colored blood red, but that's like little bit streak, and I'm thinking it's from my gastric. So when you're talking about coughing up blood, is it like your whole handkerchief there's a huge red blot?
Yes.
Okay, so traces of blood could be your gums or no?
Yeah.
That's not.
No. Traces of blood.
It's not.
It's not.
So it's like real drop of blood.
Imagine when you have phlegm. When you have cough, right?
Yeah.
You develop phlegm.
Yes.
You try to expectorate the phlegm, you spit it out.
Yes.
Then let's say for example, spit it out on a tissue paper.
Yes.
So it blots, right? It's a
Yeah.
big yellow thing there.
Yeah,
Okay,
yeah.
although it's gross. It's a big yellow thing there. Imagine that being red. So
Bright red.
Bright red. So that is blood that came from your lungs.
Okay, and that, no matter whether it's cancer or not, is something you should go to the hospital.
Yeah, immediately you should go, especially if you are coughing persistently and you are not responding to any medications yet. Yeah, that is a sign. And then if you develop chest pain as well, that is often worse during coughing or when you breathe, you develop chest pain. That is also a sign. But just don't go to the ER when you experience this, because there is something that we call a costochondritis.
Which is
That is when you breathe, when you inhale deeply, there's a sharp pain that you feel. That is because of your ribs getting inflamed. It's not because of lung cancer. Okay, you have to correlate. Okay,
so
these symptoms that I am explaining to you, these are happening all at the same time.
all at the same
Okay?
time.
All at the same time, not just one. Okay, so you
Don't scare yourself too
Don't
much.
scare yourself. Okay. Then you also have unexplained weight loss and shortness of breath. Okay, so as expected, you will have shortness of breath because you are persistently coughing.
For the unexplained weight loss, I just want to speak to lots of our audience out there. Today, many people want to lose weight. So when we have unexplained weight loss, we think it's a good thing. You know, I personally have friends who are high level of diabetes, burning fat instead of normal sugars,
Sugar, yeah.
and they lost weight so quickly. They thought they were on the right diet, but it turned out that they were very severely diabetic.
Yes.
So don't just think weight loss is great. Okay. Yeah. Be mindful.
Yeah. Okay, so now let's move on to the difference between small cell and non-small cell lung cancer, aside from its name. Okay, so for small cell lung cancer, the major risk factor is smoking. So this is a very aggressive form of lung cancer, and if you are a smoker, the lung cancer that you can get is more often than not is a small cell. But of course, you can also get non-small cell. Okay, because for non-small cell lung cancer, smoking is still a risk factor. But people who are non-smokers can get this also as well. Okay, because this will now be the most common type of lung cancer among non-smokers. Okay, and for non-small cell lung cancer, it grows much slower. Okay,
Which is why it has like an 80 to 90%.
yeah, that's why it has a better prognosis. Okay, so next, let's go to the diagnostics. How do we diagnose lung cancer?
How does it look like?
It's very simple. X-ray. Okay, when
And
you
it'll look white.
yeah,
it's the white part.
Yeah, it's the white part. So as you can see here in the figure, okay, so you can see the right lung and the left lung. You have the heart. In this part, on the other side of the heart, on the right lung, is the tumor.
It should be clear, right? There
Yeah,
shouldn't
it
be
should
anything
clear.
there.
Yeah, there shouldn't be anything there. It should be black. Okay, but you have white stuff here. That is what we call as a radio opaque, yeah, in CT scan we call it a hyperdense mass. Okay, so that mass is the tumor. Now this is a CT scan. Okay, so here in the CT scan we have identified the right lung, the heart, and the left lung. So here in the left lung you can find the tumor. So the one that is gray found in the left lung, that is the lung cancer or the tumor.
No, I noticed even in the right lung there are like white spots.
Yes.
I'm reminded because I once had to go through something like this and it was like a tuberculosis scare.
Yeah.
So having spots in your lungs is just
Okay.
not a good thing.
Here in this CT scan, the white spots that you see in the right lung are blood vessels.
Okay.
Those are blood vessels because blood actually is gray in CT scan because of the calcium.
Alright.
Alright?
But in a normal X-ray, having white spots in your X-ray would be cause for further
Yeah,
investigation.
it should be further investigated, especially if it is round. Okay, because now we will be suspecting it for it to be a tumor. Okay, so what does it look like in actual form? This is what it looks like in actual form.
Oh wow.
Okay, so you have your windpipe or your trachea over here, and then beside it is the tumor. So that is the right lung at the upper lobe of the right lung. So the white milky round thing that you see is the tumor. Okay, so that is the lung cancer.
So now let's go to treatment. How do we treat lung
So
cancer?
how do we treat lung cancer? So first, let's go to small cell first. Now, if it is localized, surgery is almost always the first option. Remove it. Don't be afraid of surgery. You have to remove this. You have to cut this out immediately as soon as possible. Okay? Don't wait for it. Okay? So other
No, I just wanted to say about not waiting for it. It's very important because I was talking to Dr. Jimmy about lung cancer also. It says the moment it goes regional or it spreads, surgery is off the table.
yeah, it's off the table.
You can't cut it anymore. It's like it's everywhere.
It's
you can't
everywhere because the principle behind surgery is when you remove a tumor, you have to remove it en bloc. So what do we mean by en bloc? Everything, no, the tumor itself has to remove and its surroundings. You have to have an allowable margin for it. Now, if it spreads regionally, you can't cut out your windpipe. I mean, you can't cut out your blood vessels surrounding it, right? So, I mean, you can cut out the bone, the spine around it. So, that's why surgery is not an option. And if you undergo surgery, the chances of you dying on the table is really high. Because there are major organs that would be on the way of the surgery. And of course, if the surgeon can cut out, of course, the surgeon can cut out the major organs, no, the essential organs that have been involved. The surgeon can only cut out the tumor. So, if the surgeon can do that, why else would you go for surgery? I mean, the cancer is still there. You didn't even address the problem, you just got yourself cut out. So surgery is out of the table if lung cancer becomes regional. Yes. Now, let's see what are options if the cancer is already regional or metastatic. Then we go for chemotherapy, radiation therapy, or immunotherapy. So for immunotherapy, the type of medication that we give is what we call immune checkpoint inhibitors, like pembrolizumab, nivolumab. Now, later I will be sharing with you guys a novel. There was this news that came out.
Oh,
that
I saw.
A breakthrough in cancer therapy. So they used the same checkpoint inhibitor, immune checkpoint inhibitor, in treating these patients with colorectal cancer, which everyone, I believe, got well. They were all remission.
It was 100%.
Yeah.
Although the sample size is small, it was 14 patients. But still, amazing.
100% result with this. I mean, they are all on remission. It's an amazing thing. It will have a very big impact. Okay. Now let's move on to the non-small cell lung cancer. So for non-small cell lung cancer, everything is the same, but we have an additional weapon here. We have a tyrosine kinase inhibitor called erlotinib. Okay, so this one is also a very good drug for this type of lung cancer.
So it's very effective.
Yeah, it's also very effective.
Alright.
Okay. Now, what is the role of PPAR agonist in lung cancer treatment? So for PPAR agonists, we have three types, no? But the more important ones is the alpha and the gamma. So these two PPAR receptors inhibit the tumor growth. It promotes cellular differentiation or cellular maturation. Remember, cellular differentiation is a hallmark of cancer. Or when you read your biopsy results, right, you have a poorly differentiated
you
tissue,
see this
or cells.
poorly differentiated. Yes.
It means that they are not differentiated. It means that the structure of the cells are very haywire. There's no organ, or it's not organized. So that is how cancer is, because cancers replicate rapidly. They don't have time to organize it. It doesn't have time to organize itself. Okay, so promote cellular differentiation. Now, PPAR agonists also enhance the detection of cancer by the immune system during immunotherapy.
Wow, that's great.
Yeah. Okay, here's another benefit that using PPAR agonist for lung cancer treatment. So remember, cancer can actually evade the immune system.
Yes.
Now, PPAR agonists can actually help immunotherapy to inhibit this evasion of the cancer.
So it will help to detect cancer.
Yes, it will now help the immune system detect the cancer. Okay, so your immune system will know, okay, this is the cancer, let's destroy this. Okay.
You know, in short, Doc, that is PPAR is basically natural immunotherapy.
Yeah.
That's
in
what
a
it
way,
is.
Yeah,
That's
in
what
a way,
it is.
Yeah. In a way, it is a natural immunotherapy because you have microalgae, which is food.
Yeah.
Okay, you're not using any synthetic medication here. All right, and lastly, since you are probably you're going to be undergoing chemotherapy and radiation therapy, and as we always say, PPAR agonists can mitigate bone marrow toxicity. Okay,
Protect your immune system so that you have lower recurrence. So that when you beat your cancer, it will hopefully there's a better chance that it will be the last time that cancer appears in your life. I think that's very, very important.
Yeah, it's very important. Of course, you have to be able to preserve your immune function as well, because if you undergo chemo, radiation therapy, it's almost always the immune system that drops. Okay, especially if you have a lung cancer, then your chances of getting pneumonia will be very high as well. So it's really very important.
It's so important.
Yeah, it's very important for you to be able to preserve your immune function. And of course, anemia can also happen if your red blood cells goes down, because red blood cells are also produced by the bone marrow. Okay.
You know, Doc, when you talk about this, I remember a patient in the province that I think they were going for chemotherapy, and maybe the immune system was compromised because of all these treatments. The patient actually died of pneumonia.
Yeah.
All right. So when you're undergoing fighting cancer, you gotta keep your own body's immune system up still, because the other illnesses are still possible risk in your life, right? Like pneumonia. Doc, I see many questions coming up. Before we move to the AMA, I just want to share one final good news with all lung cancer patients that are watching us is that Simply Nature has actually done a clinical research and trial specifically on lung cancer. And Dr. Jansen has actually quoted from that published medical journal, which is that it actually promotes lung cancer cell death. Right? That means the more you take Simply Nature PPARS liquid extract, the higher the occurrence of natural lung cancer cell death, or the technical term is apoptosis.
Yes.
So the good news is that our products have actually been specifically tested with for lung cancer, but I believe it's for non-small cell lung cancer. So that's super good news on already a very treatable lung cancer type. So without further ado, let's move to the Ask Me Anything segment.
Hi everyone, good evening. My name is Sheila and we are now in the Q&A portion. You are watching another episode of Simply Healed, brought to you by Simply Nature. Today's topic is about lung cancer. We hope that you have learned a lot from the discussion brought to you by our two gentlemen tonight. So without further ado, to answer all our questions, I have here with me our PPARS expert from Singapore, Sir Sean Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Calalan. Good evening, sir, and good evening, doc.
Hi everyone. Just want to say hi to Lily from Malaysia. It's always nice. She's like a regular now on every Thursday. And I saw new people from other countries. Borneo. Borneo is Sabah, Indonesia, right? Malaysia, Indonesia. Pardon my geography. I kind of forgot which country Borneo belongs to. But yeah, and last week we had people from Africa join us. According to our registration today, we have people from quite a few countries. So let's see if they drop in later tonight as well. So welcome again to our Ask Me Anything segment. Doc!
Hi, good evening everyone. I hope you learned a lot from our lecture a while ago. So, actually, we've prepared a little something for you tonight. Okay, so just to check if you learned something, we're going to ask you questions before you ask us questions.
Yeah, normally it's ask us anything. Today we're going to ask you, alright? We're going to ask you. So have some fun. Have some fun. Just check if you've been improving over the last few weeks.
Or if you have been listening, okay? Yeah.
Yes. And just like our few weeks ago, we are also simulcast streaming
on
simulcast
YouTube.
on YouTube.
So just want to say hi to our YouTube viewers. Welcome again to our Simply Healed program. Every Thursday, we are the longest running cancer-focused program with Ask Me Anything, which is a free flow Q&A segment every Thursday live. So we're always happy to answer any question, any medical question, or any question you would like to ask.
Alright, okay. This question was asked to me by...
Wait, are we going to do the Q? Are we going to...
the quiz first.
Quiz
quiz.
first.
Yeah,
We're going to
first.
quiz them before we answer their questions.
Okay.
Okay. We're going to do a share screen. Oh, wow. Lung cancer quiz questions. All right. Okay, so interesting. Okay. Are you guys seeing it on your screens? Oh, yes, we do. I'm seeing it on the screen. That's right.
Okay, yeah. For the first question, if you have been listening to me a while ago, okay? So the following are risk factors for lung cancer, except A, smoking, B, older age, C, sex, and D, sedentary lifestyle. Which do you think are not the risk factor for lung cancer? It's not the risk factor for lung cancer.
So which out of these four answers does not belong there? It's not a risk factor. All right.
Alright. Feel free to answer using the letters, alright, that you're seeing on the board. Okay. Oh, I can
Alright,
see.
come just type. Someone type C. Very fast.
Very fast.
Yeah, very fast.
Competitive.
Alright, very
Okay,
good.
go.
Everyone are answering C. Okay, just keep on answering.
Alright. Even those on YouTube, please type on
Yes.
comments. Yes, I see some answers from YouTube. Okay, this is fun. Alright. That's the correct answer, right, Doc?
It's actually sedentary lifestyle.
Oh, wow!
It's actually sedentary lifestyle.
Oh, wow!
Okay?
Sex is a risk factor in
Yes.
lung cancer?
Males.
Wow!
Okay. Let me explain. No, it's actually a good way. No, so we get to learn by doing this. No, so why is it not sex? Okay, being a male. Okay, it's because of the occupations that men take. Working in a mining facility, working in the industries, like construction. If you are someone driving in an open vehicle like a jeepney, okay, so you will be able to inhale all the air pollution.
Yes.
So that is one of the reasons. Chefs mostly are male.
Yeah,
I
but,
think.
but why would sex be
It's because of the tendency of occupation.
you're not talking about the act of sex.
No, that is gender, okay? Male and female.
We got
Okay, I think all the audience is like me,
Ah.
right? Everybody. I think everybody thought it was sexual intercourse does not cause
Okay.
lung cancer.
I
Okay, well, that's great. We have a good laugh all together.
You tricked us, though.
You tricked us.
Okay.
So Doc meant whether being male or female,
Male and female,
does that
okay.
affect your risk of getting lung cancer? So yes, males have a higher risk of getting lung cancer in general. Okay,
Yes, okay,
But,
and,
but let's go back to that topic though. Are there benefits to having regular sexual intercourse for your immune system for health?
It's a form of exercise. So, I mean, by all means, go. But of course, to your wife or to your husband. Okay?
I read also, Doc, that, in Chinese culture, sex is also, it does affect a lady's hormonal so-called balance or discharge. I mean, they actually need to have regular sexual activity. They will actually be healthier.
Yes, not just for females, I think for men as well. And it's it's a form of exercise. So if you are not fond of running,
I heard that
probably-
just one sexual intercourse is like 30 minutes of running or something
Yes,
like
yes,
that.
yes,
Very
yeah.
intensive.
Yeah, and it's not just exercise. It also builds up your relationship with each other, right?
And that makes you a happier person.
Overall, yeah.
Overall, right? Okay, so it's good to get married so that you can have someone that you can be healthy
Enjoy,
together with.
Yeah.
All right. Doc, second question.
Okay, so second question. Which has a poorer prognosis? Small cell lung cancer or non-small cell lung cancer?
Wow, this is a good one. Many people just think lung cancer is scary because normally lung cancer is one of the more aggressive and faster cancers. But there are actually two types of lung cancer: small cell lung cancer and non-small cell lung cancer. Now, which one is the more lethal one? Which one is the dangerous one? A or B?
Okay,
All right.
guys,
Quickly type in your answers.
Type in your answer. You have a 50% chance of getting the correct answer.
So Jojo says small cell lung cancer is the
Yes.
more dangerous one. How about
Yes.
anyone else?
There's only 2 options, guys.
Yeah, I used to, because I know, when you get diagnosed with lung cancer, usually it's in the later stages, and usually it's like 5 months. It's quite a very scary prognosis, so which is the one that's actually very lethal? The other form is actually much more friendly in terms of the prognosis. Okay. All right. I think okay. Wow,
Yes,
very
they,
good.
They got the right answer.
Okay,
Yes,
everyone got the
is
right answer, even
Yes.
on YouTube. Is it? Did YouTube anybody type answers? Okay.
Oh,
All right. So
yeah.
yes, it's the small cell
Small
lung
cell.
cancer.
Mhm.
Okay. Last question. Last question for the quiz before Doc Jansen and I start answering your questions. Are you enjoying yourselves? I think we've always been trying to find new ways because we have regular viewers, right? So we want to engage you and also make it more fun. All right. Yeah.
Okay, so the last question. The following are treatment options for lung cancer, except, so which of these four is not a treatment option for lung cancer? So A, surgery, B, erlotinib, C, green tea, and D, PPAR agonists. So again, which of the following are treatment options for lung cancer? Okay, except A, surgery, B, erlotinib, C, green tea, or D, PPAR agonist. So let's see who got the right answer.
Hey guys!
Alright,
Jojo
very
is
good.
fast, huh?
Jojo very fast, huh? Jojo very good, very
Yes.
participative.
Yes,
He's
the
a
answer
good
is
student.
the answer is right. C. Green tea is not an effective treatment for lung cancer.
You know, green tea, many people say green tea because it's a very strong antioxidant. It's something readily available. How does it fall into a cancer patient's lifestyle? Is it a good drink to drink compared to, let's say, coffee or normal Lipton tea? Yeah.
For green tea, yes, no. The most healthy, the I forgot the organization, but they rank the healthiest beverage. So the top is water.
Okay,
The
so
second-
nothing beats water.
Yeah, nothing beats water. But the second following water are actually a tie. Coffee and tea.
Coffee is good for you?
Yes.
I thought
apparently.
apparently okay.
Apparently.
I thought
Yeah.
it's interesting because my mother-in-law and our director Miss Jermaine, they literally, I think if you check their blood vessels, they have coffee inside, okay, because they
They
almost
love
drink
coffee.
more coffee than
Than
water.
water.
Yeah, so
Okay.
but is coffee
Yeah,
and tea?
but
Yeah.
there's a condition, okay? It's plain coffee. So you
Oh,
don't
no
mix
sugar.
it with the sugar, you don't mix it with milk, nothing. Just
That's true.
brewed coffee.
Jermaine looks very young, almost like anti-aging, and she drinks a lot of coffee, but no milk. No milk, no sugar, just plain black brewed coffee.
okay. So the other one is tea. So it's the same thing, no? But for tea, in terms of battling cancer, green tea, specifically green tea, is more effective for breast, liver cancer,
Oh, that's good to
colon
know.
cancer, but not for lung cancer. They've actually experimented it already. Green tea would be more effective for patients who have lung cancer who underwent radiation therapy. Yeah, so the green tea, you can actually apply it on the
Radiation wound.
area.
Okay.
Yeah. So it has a soothing effect. It can help heal the radiation dermatitis much faster. But for the lung cancer per se, it doesn't have any effect.
Okay, but
Okay.
for those with radiation burns, we would also like to introduce to you 80 Pro, which is actually a therapeutic level probiotic for your skin. So this is not the same probiotic you'll find in moisturizers or cosmetic lotions. This is something like really serious, really much stronger, just like when your kid when a child needs medical probiotics, this is what the doctor prescribes. So that's available for healing. So those with skin issues can explore 80 Pro. If you want to know more, just type in a messenger and someone will get to you.
Talking about 80 Pro, sir, we actually have a very special promo ongoing. Alright? for
Oh
80
yes,
Pros.
because 80 Pro is a new launch, it's a new product. We really want to reach out to let a lot of psoriasis patients, eczema patients, cancer patients who have undergone radiation therapy for the burns, all right? Because normally for radiation therapy, the doctors will just prescribe aloe vera, right? Aloe vera gel so that it's more comfortable. But really, the 80 Pro will help with the healing of the wound. So because of that, we are giving out a pre-launch buy one, get one. All right. The official launch of AD Pro will be 2023. So we'll be providing more seminars and information. But this year, 2022, is like a soft launch. So for those who want to, it's the best deal you can get now. So just drop a message, and Sheila and Beth will direct you to the how you can avail the products.
Yes. All right. Okay, well, we are seeing some questions coming in right now. Are you ready to take the questions?
Yeah, let's take questions, Sheila.
Okay, let's begin answering their questions. It's now their turn.
Yes, it's now your turn to ask questions. By the way, guys, anything we say, ask me anything. So that means cancer related or diabetes related are very much welcome. Okay? Alright. So for our first question for tonight, coming from Miss Lorna Padua, what size of nodule in the lungs can be considered as a cancer already?
The size doesn't matter. Okay? It can be a cancer regardless of the size. What is the criteria for us to diagnose that it is indeed lung cancer? So number one, without biopsy, okay, without biopsy. So you should have the symptoms. So incessant cough, you cough up blood, bright red blood. So those are one of the telltale signs. And then on X-ray, you have that pulmonary nodule. Okay, and of course, over time, we notice a change in size. Okay, so those things point to malignant or point to cancer. Now, of course, that's only signs and symptoms. So for us to confirm that it is indeed lung cancer, then we have to get a biopsy. Okay, we have to get a sample of the tumor and then look at it under the microscope to see that yes, this is indeed cancer, and you can actually know more what kind of lung cancer it is. Non-small cell, is it small cell? Then actually do immunohistochemical staining to know what kind of treatment would be effective for you. Okay, so to that extent, so having biopsy done is actually very important. Okay, yeah. So it's not about the size. Okay, it's about the pattern of the symptoms, the signs that points towards a cancer or malignancy, then a confirmatory biopsy. Okay.
Doc, what other kind of like growths in the lungs can people mistaken? Some people are afraid. I may have lung cancer. But if it's not lung cancer, is it common to have benign tumors, or is it like more like tuberculosis possibility?
Yeah, you're right.
Okay.
Tuberculosis can actually be mistaken. So for tuberculosis, actually, the pattern is usually at the upper lung part, no? At the apices, at the top of the lungs. Okay, usually that is where tuberculosis resides. Then once you are healed, no? Once you have recovered from tuberculosis, then there can be scarring. So those scars can be mistaken.
Okay. So it's a residual scars, leftover scars from tuberculosis.
Yes. But it's not something that is dangerous, even when there is scarring. It's just there. Okay, so it's like a scab that doesn't go away. But the scarring of the scarring from tuberculosis can actually sometimes go away on its own as well, no? But it's case to case. I have seen a lot of patients with this. Sometimes it just stays for a very long time, sometimes years, but sometimes it just goes away on its own throughout the years. Okay, so some other cases would be, for example, you are someone who is immunocompromised, then you got a fungal infection in your lungs. So, but this is kind of like terminally ill. So it can also manifest as a sort of like a ball shape, no, at the chest X-ray. But it's not actually lung cancer, but a fungal infection. This is what we call as aspergillosis. Okay, so aspergillosis only occurs when you are already immunocompromised. The immune system has gone down so much. Usually this happens when patients are on multiple antibiotics long term for a very long time. So patients who are admitted inside the hospital, and then doctors have been giving a lot of antibiotics to kill off the pneumonia, and then sometimes. And of course, the patient should be on steroids as well, no? So the immune system is really down.
So steroids actually lower our immune system?
Yes, it's an immunosuppressant.
Oh wow!
Okay.
So that's why it's like an antihistamine as well.
Antihistamine, no, not not
Because people always
antihistamine.
use steroids for cream.
For cream?
Yeah, it's
Ah,
because it's
yeah,
suppresses the immune
yeah.
response.
Okay. For this, no, the steroid creams. Okay, it's because eczema is actually because of an overactive immune system. So you need to calm the immune system down. Okay, so sometimes it manifests on the skin. Steroid creams would be already effective, no? Just to suppress the overactive immune system and to lower the inflammation. Okay, that is causing the redness of the skin. But I'm talking about here steroid use, oral steroid use.
Okay.
Okay, so for whatever reason, it can be because of a stroke or yeah, there are a lot of reasons why why doctors give steroids while you are in the hospital, no? But yeah, going back on topic, yeah, aspergillosis is it can be mistaken, but that is for hospitalized patients only, terminally ill actually. Okay, what else? What else? Sometimes it just happens. When you have an X-ray done, there's a granuloma. So a granuloma is just a nodule, okay, and it's not growing; it's just there, sort of like a mole, okay. So you don't have to worry about it. Just monitor, okay. So how often do you monitor this? Once a year X-ray would already be enough, okay, just to make sure that it is the size is not growing, okay. So those things. Okay.
All right. Next question, Sheila.
Okay, alright. Another question coming from Reinbert. Hello doctors, what is your take on vaping instead of smoking? Do vaping cause lung cancer?
Oh, vaping
yes.
and smoking. Yeah.
Yes, actually, vaping can cause lung cancer. Okay, and not just lung cancer. Vaping has been associated with bladder cancer, urinary bladder cancer.
Bladder cancer.
Yes. The other one is nasopharyngeal cancer.
Wow.
Yeah, because you inhale the fumes.
Oh wow, that's terrible.
What else? Throat cancer.
I think it's terrible because when you smell cigarette smoke, right, you would tend to cough because it's carbon and things like that. But when you smell vape, sometimes it smells like what, cherry apples, and
smells
pleasant.
Yep.
But it's actually very bad for you. Wow.
Yeah, because there are certain chemicals that when ignited, no, it has carcinogens. So yeah, so vaping is not actually a better substitute for smoking. The better substitute for smoking is to stop. Okay?
Is to stop.
Yeah.
I know personally, I think vaping is more dangerous than smoking, because in today's world, if you smell like a cigarette smoke, many of your family members will scold you. Why are you smoking, or something like that? So it's a very clear signal that it's not something good. But vaping really, it smells really sweet. They have caramel flavor, they have cotton candy flavor, and that could be very deceiving. So to all the parents out there, watch your kids, your teenagers, or even your young adults when they start on this, and let them know that vaping is not safer than cigarettes, and you could probably end up vaping more than you smoke cigarettes, because it is so sweet and pleasant.
Okay. Another question coming from Miss Ronelli Cruz. I'm done with the lumpectomy, 33 radiation, 4 chemos, and 18 trastuzumab. I am breast cancer stage 1, ERPR negative, and HER2 positive. What is the difference to triple positive to double negative positive? Thank you.
Okay. The difference, this is breast cancer that she is talking about, no? So for everybody's information. So we have different types of breast cancer depending on the receptors that it has. So the ERPR means ER means estrogen receptor. PR means progesterone receptor. And HER2 is HER2. So it's HER2 positive. So it's a receptor that the breast cancer cell manifests as well, no? So depending on which receptor the breast cancer cells has, the doctor will prescribe a specific treatment for you. Okay? So ERPR positive means that the breast cancer cell is hormone receptor positive because estrogen and progesterone are hormones, okay? So if you can recall your high school biology, okay? So if they are hormone receptor positive, that means hormonal therapy can be done. Okay?
Oh, wow. Okay.
Yes, okay? Now, what now for HER2? So HER2 is something that if the breast cancer cell has, it is more aggressive. Okay? Now, since it is more aggressive, the scientists have developed a specific drug that targets these types of breast cancer cells, which has HER2, okay, which is called trastuzumab, which the patient is taking. Okay, so now the difference between triple positive and then HER2 positive but negative for hormone receptor is that aside from the difference between the presence of the receptors is that if you are triple positive, then you can have hormone therapy. Hormone therapy will be effective for you. Also immunotherapy, specifically trastuzumab. However, if you are negative for hormone receptors like ER and PR, or estrogen and progesterone receptors, but only positive for HER2, then it's only trastuzumab that will be effective for you, but not hormone therapy. Okay, so your onco will not prescribe you with hormone therapy because there's nothing that the medication will attach to.
I think, Doc, the basic question for most patients when they ask a question like that, am I double positive or what, is my cancer worse? I think that's the basic question. I think when most patients are asking, did I have the worst type or the safer type of cancer? I think in her question, is her cancer, should she be more concerned that her cancer is more aggressive, or is the less aggressive type?
Well, for the type of cancer that you have, it's actually yes and no. Just because you have HER2 receptor, then the breast cancer is more aggressive. However, since we have a treatment for it,
it turns out to be more targeted.
Yes, it turns out to be more targeted. You don't need chemotherapy to get well.
Okay, that's good news.
The prognosis is better.
Okay, so it's more aggressive, but because there's a better medication for it.
Yes.
So it's more, even though it's more aggressive, it's more treatable.
Yeah, it's more treatable, so the prognosis is actually better.
So for the patient who asked this question, she's HER2 positive?
Yes. Yeah, she is HER2 positive.
So yes, you have a more aggressive cancer, but on the same time, it is also more treatable. So having a more aggressive cancer, it would mean that it's even more important for her to have a good lifestyle habit, since there's a very effective treatment. So if you make good lifestyle changes and good supplementation, that would actually mean that your cancer is better managed, right? Yeah. So I know what Dr. Jansen will say: plant-based whole food. Right?
Yes.
So really, I mean, for all cancer patients, I think you have a very strong reason to go cold turkey. That means straight away drop all your chicken, beef, and pork, right? And go plant-based at least for a few weeks, right? Before you give yourself a break. Because I think that's going to be just better for your health, all right? And we promise on our program that towards the September, towards the Christmas season, we will actually be reviewing lots of tasty foods for those patients who have to go on plant-based whole food. So look out for that.
Alright, just before we go to the next questions, Sir and Doc, I just want to greet, of course, our avid viewers. Miss Rizaline, thank you for watching again. Miss Edna Aveo, of course, our Miss Lily of Malaysia. Pinay Bayan, Lilibeth, hello. Thanks for watching again. Miss Korean, there you go. And we have a lot of new viewers as well tonight. I can see Jojo, Adrian.
And Jojo was very fast in answering the questions.
Yes, and he got the two correctly.
Yeah.
So kudos to you.
I am pleased that our viewers, our patients are actually competitive as well.
Yeah, we're going to have this every week from now on.
Every week, all right? So I think you enjoy yourself.
Yeah.
Okay.
Okay, all right. Another question coming from Bahandi. Okay, is wearing mask due to COVID? Is wearing mask due to COVID helps protect us from lung cancer, or it can cause or may cause it because it prevents us from breathing fresh air?
Okay, wearing mask can actually protect you because you inhale air pollution less.
Okay, that makes sense.
Yeah. So, wearing mask, not being able to exhale the CO2 will not increase your risk for lung cancer. Okay, so don't worry about it. But wearing mask actually will protect you from the air pollution. Okay, so you inhale less of the air pollution around you, especially if you're living in the city. Okay.
On this mask question, Doc, because we've been 2 years of living with masks, I think, I've been sitting down and there are many groups out there who are very against wearing masks, and they give a lot of reasons. You get mask pimples and all that. So I honestly, to all the viewers out there, we sit down in a calm manner and think about it, right? So first thing I thought about is that surgeons who spend every day, they go for surgery, doctors who work in hospitals, every day they wear masks, especially surgeons. And surgeons do very fine work. Their hands cannot shake because they are operating on a person. And yet they wear masks and they're able to breathe properly. Yeah, and so my understanding is now, I think if anyone has developed mask pimples or difficulty breathing or coughing because they wear masks, I think the issue is not about wearing masks, it's whether you are being sanitary about your mask wearing. Are you wearing masks in a clean way? Because surgeons don't wear masks for 2 years. They wear masks for 20 years, the 20-year career they have as a surgeon. I don't think surgeons end up with more illnesses than people not wearing masks. So I think, but I talking to Dr. Jimmy changes his mask every 2 to 4 hours.
Yes. Okay. Sometimes even more, depending on how many surgical cases or how many surgeries he performs in a day. So you can just imagine.
I think to address this issue, we think about it logically. There are professionals who wear masks all day and they are fine. So how come the normal person like us may develop respiratory difficulties or whatever? I think that the key is, are you being sanitary? Are you changing your mask often? Why would you develop pimples? Dr. Jimmy has very good skin.
Yes,
his face is pimple free, and he's been wearing masks for years. So it's not logical. So I think now it really is that those of us who are not professionally required to wear masks, maybe we will never train and we don't have the discipline to keep changing masks and wearing masks in a clean manner. Maybe we don't brush our teeth enough as well, so when we breathe into our used mask, it doesn't smell good. So I think for all the audience, our audience here, think about it. I think what I've decided after listening to Dr. Jimmy, I used to wear my mask longer because I think lazy to
change or lazy to clean.
So now I prepare lots of masks. I wear cloth masks, right? So I go through at least 2 masks a day. In the past, I would let's try to minimize the washing. If it doesn't stink, just keep wearing it, So I realized the problem with wearing masks has got nothing to do with the mask. It's got to do with how clean your habits are while wearing the masks.
Mask is still a must.
I'm quite used to masks now. Yeah.
Okay. Alright, we have another question. Oh, it's coming from Mr. Jojo Carabeo. Can PPARS replace filgrastim and erythropoietin injections to raise the RBC, WBC, which are commonly low in chemo patients?
Okay. I get what you mean. Still no, but it can make them more effective. Okay. Why is it so? The PPAR agonists that Simply Nature has, actually one of the benefits is cellular differentiation. So cellular differentiation is the medical term for it helps the cells
to mature. So
Okay.
your baby blood cells
Your baby blood cells will
become
be
proper red blood cells.
Will be easier to become proper red blood cells, functioning red blood cells, functioning white blood cells. Okay? The filgrastim and the erythropoietin are the medications or the molecules that stimulates the stem cells to grow. That stimulates the stem cells to divide.
Wow, that's
Okay.
so that the two will work very well together.
Yes, chemo patients usually use those two because if the patients who are undergoing chemotherapy, if the white blood cells are too low, then onco will inject filgrastim to stimulate the increase of the white blood cells. But the problem there is if the maturation is not fast enough, then you'll still succumb to infections, or you'll need more frequent injections.
So that's where the PPAR extract really comes in.
Yes.
Helping since the two drugs actually cause your body to produce more baby cells in your baby blood cells, and then the Simply Nature extracts help your baby blood cells become full-grown red blood cells and white blood cells. So the two actually work together.
Yes,
Doc,
yeah.
No, I actually also want to take the opportunity to ask this question. I think for many of us, as when we are patients, especially today with eating healthy, I think there's this idea that we want to avoid as much drug use as possible.
Yeah.
Which is why I think Mr. Jojo is asking this question. And even though I am part of Simply Nature and we share natural products, this is when it comes to cancer patients, I would want cancer patients to be a bit more careful. It's not like flu. So here is my approach. Doc, you can comment on it.
Yep.
If you don't want to use drugs, right, I think do a combination until you get the result that you want. Then you can drop the drug and see if your results stay strong. So for example, because you're going for chemo, like Mr. Jojo asked a question, he needs his red blood cell and white blood cell count to go up, right? So you take the drugs and Simply Nature PPAR extract. Once your red blood cell count and your white blood cell count are both high, then it's a very safer condition scenario for you to think, maybe let's try just the Simply Nature PPAR. So what I'm just saying is use the drug and the natural together and reach the safety point first before you decide to say, let's try all natural.
Yes.
I think that's a very safe approach, right? It also means that you don't use the drug for a long time. You use the drug plus your natural therapy and as quickly as possible reach the point where, hey, now I have the option to drop my drug, right? But if you only use the natural, and natural usually takes a bit longer, and if the results is not so good, your doctor might get nervous, because most of the time when a patient takes natural products, they might do it without telling their doctors. Okay, or if you're not taking your drugs, you don't tell your doctor that you're not taking your drugs. So that might scare him and might give him a wrong idea about your situation. So that's my suggestion to anyone who wants to go off drugs. Why don't you do your best to quickly reach a safety point? Then you can have a very strong option to say, from this point on, I want to try all natural. Okay, I think that's for cancer patients, I think this is a safer and more logical approach than to just say, I go natural from the start. All right.
Actually, sir, the worry about this taking too much drugs, especially for our chemo patients, is also the reason why, Dr. Jansen, you are including the cleansing plus in your protocols. Right?
Oh yes.
Oh, that's interesting. Doc, maybe you can elaborate. Why would you give like a fiber supplementation for cancer?
For cancer patients, okay. It's because the fiber, when you drink it, before, the knowledge is fiber just makes us move our bowels much better. It slides, the food just slides better, just slides faster down our colon. And fiber is not actually digestible. That's the old knowledge. But the new knowledge right now is actually we digest our fiber. But it is not our body. It is the gut microbiome that digests the fiber. Now, once the gut microbiome interacts, no, or metabolizes the fiber in your diet, it forms what we call short chain fatty acids like butyrate. Okay, so this specific molecule, no, that the gut microbiome produces is actually has anti-cancer effects, anti-inflammatory effects. It makes the immune system strong. Okay? It actually has an influence in the manifestation of atopic dermatitis as well, allergies, asthma. Okay? So, it's really quite amazing on how the gut microbiome interacts, no, with food. Now, for cancer patients who are undergoing chemotherapy, since we expect that your white blood cell count will go down, then fiber feeding your gut microbiome would, of course, make your immune system stronger. Although not really increase the white blood cell count, but even though your white blood cell counts are, in the low normal range, it can still function. Okay? You won't get cough and colds as easy. You can still fight off viruses. Okay, so I hope you get what I mean. Okay, so that is why I still include fiber in my protocols for cancer patients, especially if they are undergoing chemotherapy. Okay, but when it comes to diarrhea, because some chemo patients also can produce diarrhea, then that is the time when I take things. I can hold back the fiber, okay, because you're already having diarrhea, right? But sometimes chemo patients actually have constipation as well. So with this kind of symptom, you can actually give the fiber so that they can move their bowels much easy. Okay.
Oh, thank you. The comment by one viewer, Miss Agarado. Did I get it right? Agarado.
Yes,
She put there, better gut biome equals better health.
Yes.
Beautifully explained. I think this is a underrated thing because in our busy world, believe it or not, I used to have a friend who went to her doctor and she asked the doctor, she only goes to poo-poo once every 2 days. And her family doctor actually said, yeah, that's normal. It's not normal. Maybe it's normal. It happens to many people, but it's not healthy. All right? I think the point is because we're all so stressed, we are all like that. And so what Dr. Jansen shared is very interesting. For those of you who want to know how to get healthy naturally, your gut microbiome is actually very important. And it's also very important for mental health. Okay, it's not just your immune system, it's your mental health. One of my godmothers, is like a mother to me because she reminds me so much of my mom too, is Dr. Maribel. All right, and Dr. Maribel is a very experienced, very famous pediatric neurologist. All right, so that means she sees brain disorders for kids. So over the years, she has seen schizophrenia, depression, bipolar, all these mental or brain disorders. And as a brain disorder specialist, all right, her first question to all her patients is not like, are you seeing things, or can you concentrate, or do you have headaches? Her first question is, are you regular? As in, are you going to the CR and toilet every day? Are you moving your bowels regularly? There's a direct connection between your mental health, your brain health, and your gut microbiome. Technically, it's because of serotonin, but I think for most of our audience, just understand this. Your gut biome is very important. Maybe everybody living in cities are a bit more hot-tempered and a bit depressed because city folks who work and eat in the city, we really take a lot less fiber than, let's say, people living in the province, in the suburbs, in the farms. So again, that shows how your lack of fiber actually affects your mental and brain health. All right, so I want to thank Ms. Agarado for summarizing it beautifully. Better gut biome equals better health.
They are learning. Thank you, Doc. Thank you, sir.
Yeah.
Okay. All right, just before we go to another question, I just want, of course, to greet our viewers and registrants coming from Saudi Arabia.
Saudi Arabia, wow.
Yes, and of course, New Zealand as well.
New Zealand. Oh, I would love to visit New Zealand one day. I was just in the elevator in our office the other day, and there was a Kiwi. And he was laughing. He said, "My country has more sheep than humans." But he did tell me his house was very nice on a lake. And now living in a city here, working in this office, he says he sees concrete trees and not natural trees anymore. So to our Kiwi visitor, thank you for joining us, and please share among all your friends as well.
Yes, thank you. Thank you for joining us. Also, another question coming from Miss Weisha. My partner started at a young age smoking, and up to now he's at 40s. Any possibility to stop without complication or lead to cancer in lungs? Unknown. If relatives acquire any kind of cancer, he's afraid of the withdrawal.
Okay, the withdrawal.
Yeah, the withdrawal. Okay. If you're smoking for 4 decades, yes. If you stop smoking, you will definitely feel withdrawal symptoms. But there are ways on how to manage the withdrawal symptoms. So it's still more beneficial if you stop smoking because the benefits are really immediate. First benefit, that you can feel blood pressure will improve. You can feel that actually in a matter of hours.
Hours?
Yes.
Wow, hours.
So immediately when you stop smoking, blood pressure improves already. Okay? Especially if you have stopped smoking for at least a day, so you can just imagine the improvement. Okay, but of course, on the other hand, you will feel withdrawal symptoms. So there are ways on how to manage that. So we have nicotine gums, nicotine lozenges.
Not vaping.
Not vaping.
Okay, not vaping.
Vaping is not a good substitute for smoking. Okay, because it can do more harm than good. The benefit, you won't get the benefit. You'll just have a better smell,
better
overall,
breath.
a better breath overall. But you're still unhealthy. The risk for lung cancer is still there. Okay, for withdrawal symptoms, we can manage that. We have Champix or Varenicline. We already have that, so easy. So if you want me to help you, help you stop smoking, just go for a consult. We already have a program for that. Actually, step by step, a weekly medication that you can do. Then,
Doc, just to ask, because I'm not a smoker, so I don't know. Is it very easy to find nicotine gum? I mean, where would a normal person find nicotine gum? Because I go to the drugstore, I don't actually see it.
You have to prescribe that.
Yeah.
Yes, it's a prescription drug.
Oh, okay. No, that's why I don't see it in the counter at the drugstore.
Yeah,
it's behind. All right. So maybe to our viewer also, he might be wondering, where do I find nicotine gum?
Yeah.
Okay.
But here in the Philippines, it's Mercury Drug, Watson's. Watson's, I think it's in Southeast Asia.
Is it expensive?
Yeah. In terms of the price, it can be a little bit expensive.
Okay, but in Singapore, it's not going to be expensive because in Singapore, cigarettes are super expensive. One pack of cigarette can almost come close to $20 at the big box, right? No, we're not talking about carton. We're just talking about one pack.
Yeah.
Right? Yeah. Okay.
So but of course, if you think about long-term financial, long-term expenses, it would be better if you stop smoking now. So
for the viewer, for her boyfriend or her partner, right? How long do you think it will take him to manage his withdrawal symptoms? If he's been smoking for 4 decades, how long? So that he has a mental preparation also.
Yeah.
I mean, what would your estimate be? Without an actual consultation.
I would probably between 3 to 6 months.
Wow. Okay, so it's not. So he shouldn't tell himself, "Oh, in 2 weeks I'm gonna be okay."
Yeah.
So
you need the nicotine gums, the lozenges, the medication, and the medication is prescribed for at least 12 weeks.
All right. Okay.
So it's that span of time.
So I think that's a very. I hope that answer from Dr. Jansen helped this viewer, because then you won't feel bad. Many times when we want to go and we want to slim down, and then we fail, we feel so bad, and then we give up. and then we say, let's just stay fat.
Yeah.
You know, so I hope also as a smoker, you don't feel bad that, hey, how come I tried for 3 weeks, I still feel the addiction, I still feel the withdrawal symptoms. So the answer now is that's normal. You're on the right track. Okay, you're gonna be fine. Right, just push on a little bit more, and you're gonna be good. All right, and I'm so happy that this viewer is thinking about quitting, because I just want to share with you, you know, because we are in the business of in the industry of caring for cancer patients, lung cancer is not good news. All right, it is something that when a patient gets it, even the doctors are worried for the patient, because usually the prognosis is it's a very aggressive cancer. It's not good news when you hear lung cancer. So do it's a good decision to want to quit smoking.
Yeah, and just to echo out once again, the vaping is not a least evil option.
Yeah, vaping is not an option at all. You are switching one addiction for another that still causes cancer.
Yes. Okay. All right. Thank you, Doc. Thank you, Sir Sean. All right. Another question. As secondhand smoker and my mother-in-law exposed, is it higher chance to develop lung cancer? For now, as I encounter another person who smokes, I had irritation to breath. Do I have to be checked?
I think so, because secondhand smoking is like smoking. Your risk for developing lung cancer is still up. No, actually you can also develop COPD, not just lung cancer. But along the way, you can have these diseases as well: asthma, COPD, or chronic obstructive pulmonary disease. You can have emphysema, just because of this, bronchitis as well. Irritation in your throat, in your nose, which can manifest as allergies. So sometimes when you get to inhale the smoke, it's easy for you to sneeze. Yeah, sneezing is one of the manifestations or symptoms of allergy or a height of an allergic reaction. So these things, from mild to severe diseases, you can experience. Okay, so it's really very important to
when you say ask her to go for a checkup, what kind of checkup? She go to a family doctor, or what checkup should she go for?
Okay. Actually, a family doctor would already suffice. A GP, family doctor.
And what would the family doctor likely do?
Okay. Number one, auscultate. Okay. The doctor will listen to your lungs. If there are any decrease in breath sounds, then
wheezing sound.
Then if the doctor finds out, okay, you have some breath sounds that I can hear, abnormal breath sounds here and there, then the doctor might request for an X-ray, chest X-ray, then spirometry. So spirometry is the device that is the procedure that you use to diagnose asthma. Okay, so aside from that, pulmonary function test as well. Then what else?
All these things that you say is not really expensive, right?
No, it's not. It's not.
Now, I always ask this because I always think from a point of a patient. Is this gonna cost me a lot of money?
Yeah.
Okay.
You won't spend more than 3,000 for those tests.
Okay. Those international viewers. Okay, 3,000 pesos.
Peso
is
okay,
like
peso.
$60. Okay, so it's really not $60 today. You can't buy much. So especially in our inflation rate right now. To this viewer, because you gave a little bit of background that it's your mother-in-law, I just felt that it's as a responsible person, I just want to remind you, don't get angry with your mother-in-law, all right? Because don't get angry and say, hey, mother-in-law, you're causing me health problems, because an angry mother-in-law will cause you more than health problems, okay? So my advice is, if you go and see a doctor, then at least, and with a nice tone, let your mother-in-law know that, wow, it got her secondhand smoke that she's giving you is serious enough for you to have to go and see a doctor. So maybe that's another good reason to go and see a doctor, right? So that your mother-in-law also know, you're not just uncomfortable with the smoke and smell, that it's actually give you some health scare. health concerns, all right? So use that in a gentle way. Don't use your medical report to smack your mother-in-law and say, look what you're doing to me, okay? I think if you argue with your mother-in-law, your husband will be stressed, everybody will be stressed. It'll be worse, all right? So that's just my 2 cents worth, all right?
Look, I'm very curious. Is it safe to say that secondhand smoking is more dangerous than?
Oh, yeah. There's some reports that actually say secondhand smoke is more dangerous than first-hand.
Is it as dangerous?
It's as dangerous.
It's as
dangerous. Yes. In fact, no. The first-hand smoking, or if you smoke the cigarette itself, that would be more dangerous because you are not just inhaling the smoke. There are also other chemicals found inside the filter that you can inhale directly. Okay, so if it's a second-hand smoking, then you're just inhaling the smoke, the fumes, and of course the smoke would have to travel a significant distance before it reaches before it reaches you and travel inside your lungs. No, so yeah, if you smoke the cigarette itself, okay, then that would be more dangerous. But in terms of statistics overall in the general population, in terms of lung cancer risk, both are as dangerous. Yeah.
Anyway, secondhand smoke is sometimes first-hand smoke because if the cigarette is just being held on a finger and a smoke, that's actually first-hand smoke, right? Okay, yeah.
All right, thank you. By the way, just before we proceed to another question, for our new viewers, I know that I've mentioned our avid viewers already, but for our new viewers out there, please don't forget to like and follow us here in our Facebook page, Simply Nature International, and of course our YouTube channel, Simply Nature. All right, so that you'll always be updated. All right, for about our online next online events.
Did we show the back to school thing just now? Yeah. All right. Okay.
Yes, we have. Oh. Alright, so for our next question here, just type in your questions, we'll try to answer more questions pa. Okay, for Miss Linda Sirigoy, is there any risk of interaction with between chemotherapy and radiation in a negative way?
Negative way in the sense that both can decrease your white blood cell count, red blood cell count, sometimes platelets, no? But that is really bad already. Okay, but there are certain types of cancers that chemotherapy and radiation therapy have to be given simultaneously. Okay, like your cervical cancer, nasopharyngeal cancer as well. Okay, it's because why are they given together? It's because there are certain parts of our body which are not sensitive to radiation. Okay, and you have to give a radiation sensitizer, which is often a chemotherapy drug like cisplatin, to make the radiation effective. Okay, so both have to be given simultaneously together. Okay.
I see a question right now on my screen. It's from Miss Risa, and it's related directly, Doc, to what you just talked about, which is red blood cell count being very low. So, Doc, before you give your medical answer, I just want to straight away tell Miss Risa, use the best option right now that I know of, since you want natural. What is the natural way of raising my red blood cell count? Is the liquid extracts. Okay, I personally deal with patients who have this issue when they're going for chemotherapy. Okay, because especially experimental chemotherapy, the red blood cell count actually normalizes through the use of liquid extract. And how fast? Literally within 24 hours, there is improvement in the red blood cell count. So, Doc, to the more technical answer to this. Okay. I mean, at least I just let Miss Risa know straight away there is a solution, there is direct solution that is addressing your concern. Okay.
Yes, actually that is what I will prescribe you with, no? But I would encourage you to go for a consult so I can have a better background on your case. But as it is right now, no? For 8 months, RBC is still very low. I really want to know how low, because sometimes the laboratory results can be misleading. Okay, what we perceive as low, sometimes it's already acceptable. Okay, so, and it's already been 8 months. So I encourage you to have a consult. But if it is really low, I mean dangerously low, you're right. Do not eat liver because that will make your cancer worse. Okay. I would recommend for you to eat more green leafy vegetables and root crops, especially carrots. Yeah.
Okay.
I would start with those. But sometimes, depending on the severity of the red blood cell count, no, if it's really low, then I might prescribe you with erythropoietin as well to stimulate the growth of red blood cells inside your bone marrow. And of course, together with Simply Nature PPARS, that we can make that happen much faster. Okay, so we give you a lower dose of erythropoietin as well. Okay.
Miss Risa, Miss Risa asked she's very happy. That's great news. And then her next question is liquid extract expensive? All right, here it is. I would just let you know it is not cheap, but here is the important thing when you work with, when you call us and when Dr. Jansen and his team or even Simply Nature's team give you a consult. We will work with your budget. All right, I think this is something that is very different from, let's say, you go for chemotherapy. When you go for chemotherapy, you cannot work with your budget. You have to go for 8 sessions.
Yeah,
you can't say,
yeah.
Can I work with my budget and go for only 2 sessions of chemotherapy? All right, so for us, there are many options, many combinations. You can start with liquid extract, but you can maintain it with another protocol, for example, or soft gels. Once your red blood cell starts increasing, all right, you can opt to have liquid extract. Take maybe you get 1 box, you take 1/3 of it, and if there's really good results, you can save the rest of the 2/3 for later. You can move to a soft gel, which is much more affordable, almost like normal price, like normal supplementation price. And then if, let's say, you go for a chemo session or you take your drug and then you see a drop, then you still have the liquid to quickly boost it up. So there are many combinations. What's important for you to know is, don't worry, a lot of our patients are not wealthy patients, but we work with them to come up with something that works for them. Important is, of course, cancer is always an illness where if money is not an issue, you have you have more options and you have more powerful options. I just want to let you know that at Simply Nature, our teams will work with you to get the optimal, the best combination for your budget. All right, but of course, if you have no budget constraints, just let our team know also. Then they will recommend to you the best of the best of the best. All right, yeah.
That's true. Don't worry, Ms. Risa. We'll get in touch with you directly right after the program. Okay? All right.
Actually, Doc, this is the one thing. When a person gets cancer, first thing they fear is this going to be lethal? The next thing they worry is this going to make my family bankrupt? Yeah, and I just want to share with all the cancer patients. We work with cancer patients, so we're very aware of this fear that you have, and I just want to give you comfort. Okay, no matter your budget, there is always something you can do. All right. Now, those with lower budgets have to be more disciplined.
Yes.
All right. That means you can improve the results of whatever protocol that Dr. Jansen give you by being extra disciplined. For example, really eating only the right foods, really controlling your environment, managing your stress and all that. Okay, so I just want you to be, every cancer patient to be positive and realize that effective treatment is within your reach. Just go for a consult and work with our team.
Let us work with you.
Yeah.
Right, along your journey. Okay. All right. I guess this will be our last question.
Last
for
question.
tonight, Okay. All right. Coming from Ms. Coles Tumbagahan. Good evening. Done with radiation and chemo and surgery. What natural supplement can you recommend for me, sir and doc, to prevent the cancer to grow again?
Okay, so we are talking about prevention.
Yes.
Okay, so number 1, you should be eating a whole food plant-based diet. Okay, that is the only diet that has been proven to actually increase the survival of cancer patients. Okay, and then number 2, okay, supplements that you should be taking. I would recommend you an immunomodulator, so beta-glucan. But beta-glucan, the best source for that are mushrooms. So yeah, eat mushrooms. Green leafy vegetables as well. Nutritional yeast. Nutritional yeast is actually really very good for the
Where
immune system.
where do we buy nutritional yeast?
Healthy options.
Can we find it in like normal supermarkets?
Here in the Philippines, no. It has to be healthy options.
All right.
Or if you can buy from an e-commerce platform, Lazada, Shopee. If you're abroad, no,
yeah.
other countries, Amazon. If Amazon is the one that you use in your country. So yeah, those are some of the platforms where you can buy nutritional yeast. And nutritional yeast, it looks like Parmesan cheese, no, but it's not cheese. Okay, it just looks like Parmesan cheese. It's powdery, like it's actually flakes. You can put it on everything. Put it on pasta, put it on your vegetables, put it on your beans, or anything. It has an umami flavor. It's really quite good.
Yeah,
Okay.
I've tried nutritional yeast. It tastes good.
Yeah, probably if you are a popcorn lover, yes, cancer patients can eat popcorn.
Yes,
Okay.
just don't put butter, right?
Yes, just don't put butter. You can put instead nutritional
Nutritional
yeast.
yeast.
Okay.
Okay.
Other foods, soybeans. Okay, don't be afraid of soybeans, especially for breast cancer patients. Soybean is actually the natural or the food that has the same effect as the hormone therapy.
Wow.
Okay? Yeah, it's actually hormone therapy. Okay, so your tamoxifen.
Then why is there this like crazy myth that
Yeah.
soya bean
Can-
adds to cancer because it's because of the estrogen or
Yes,
yeah.
it's the estrogen because soybeans are actually very rich in phytoestrogens. And from the word itself, phytoestrogen. So these are plant estrogens. Okay, it's not the same as animal estrogen. The two estrogens work very differently inside the human body. Okay, estrogens primarily work. It's a growth hormone. Okay, so it's for the menstrual cycle of women. All right, but for phytoestrogen, it works differently. Phytoestrogens actually helps make your bones strong. Okay. Another one is it acts directly on the uterus. Okay, so if you are someone who has very bad dysmenorrhea, okay, then phytoestrogens will be really very beneficial for you. So eat tofu, eat soybeans. For women who are on that period of your life where you have hot flashes, okay, yeah, tofu is again a very effective way to manage those hot flashes. Okay, then for the cancer itself, okay, it has the same mechanism as tamoxifen. Okay, it blocks. So you have your estrogen and progesterone receptors, right? So how does this receptor participate in tumor growth? So your estrogen, the estrogen that your body produces attaches to that receptor. Now when that estrogen attaches to that receptor, to that estrogen receptor, then that will stimulate the breast cancer cell growth. Okay? Now, phytoestrogens block the attachment of the animal estrogen to the estrogen receptor, similar to what tamoxifen does. Okay, but of course, having said this, please do not stop taking your tamoxifen. Okay, continue taking your tamoxifen and continue eating your tofu. Now, in terms of population studies, so this is in theory, okay, but does this theory manifests in the real world? Okay, yes, because scientists have actually studied populations which has high soy consumption, and we can find the lowest breast cancer rates in
So
these populations.
that already busts the myth that soya bean
yes.
causes breast cancer.
Uh-huh.
So so that's a myth. All right. So now if you're concerned, because I know, but there are very interesting things like people with swollen knees, they are encouraged not to take what's that?
Beans,
right? Yeah, but it's, Dr. Jansen actually will explain to you in a consult why this is why it happens. But because we are short for time here, maybe we can cover it next time. So there are a lot of reasons why this myth, this fake, not fake, but misconception came about because of certain symptoms. But that is caused because of other aspects of the lifestyle. And if you don't correct that, then you see some of these symptoms. Okay. Now I just want to, because we are short for time, we are already 9 p.m. and thank you everyone for staying until so late. Our YouTube viewers are actually increasing as we approach 9 p.m. I just want to answer the last question together with Miss Sonia's question.
Yes, please.
All right, which is the best supplement that can, as a foundation. I'm not saying that it's the only supplement you take, but the best foundational supplements that you can take as a cancer patient is probably our PPAR tablets. And if you are in the early stages of just recovering from cancer, that means you just declared cancer free, then you might want to go for our extracts just to make sure that your immune system, and we don't have time to go into deep detail, just watch us next Thursday. I'm sure you hear it again. All right. It will lower your chances of having recurrence, boost your red blood cell count, white blood cell count, your bone marrow production of blood cells. Everything boosts up as quickly as possible, and that will get you to stay cancer free as fast as possible. And then just after the initial period where your body is strong, just use the Simply Nature PPAR tablets to maintain. And this has many advantages because Simply Nature PPAR tablets are already clinically proven that we can help manage blood sugar, blood cholesterol, and general chronic inflammation. So you're going to be very healthy. And the last benefit is anti-aging. So not only are you cancer free, you're going to be good looking. Okay, I'm 48 years old. Look at me and Dr. Jansen, we look almost the same age. All right. A little bit of teasing there, but I've been taking Simply Nature PPAR tablets for more than 20 years, right? So this is I still take it every day, all right? I take it for all my blood works, and also for mainly, I'm vain now as I approach 50 years. I'm 48, I'm coming to 50. So I take it for anti-aging as well. So you see, so not only are you going to get benefit for keeping yourself cancer free, you're going to experience many other health benefits. Maybe one day, you guys, the next AMA next week, you can ask me a question like, what other health benefits apart from cancer does PPAR tablets provide? All right, and I can give you a better detail. I can prepare a slide. And last, Miss Sonia, I would encourage you to have a consult with Dr. Jansen just so that he can ask more questions. But you are right. We'll have a protocol that will be suitable for you, but just go for a consult, because I think that's the most responsible thing before we advise you to have a clearer picture of your health and where you are right now. So with that, I just want to thank everybody again, and I want to thank you for all your support. I'm very thankful that we have more viewers from more different countries, and that's just so encouraging for me and Dr. Jansen as we do this program. It's almost coming to 2 years now that we consistently do this, and we're so glad that we're making a difference. And I really want to thank the more vocal viewers like Miss Lily, who is always giving us encouraging comments. Please, we live off your encouraging comments. They say encouragement is like oxygen for the soul. So we also hope that our messages and the things that we share with you are encouraging to you, and that we give you oxygen for your soul for the next week to come.
Alright, Dr. Jansen?
Okay, I just want to thank everyone as well, for staying with us until this late in the night. Okay, I hope you learned a lot, and I'll see you next week for another episode of Simply Healed. Okay, so yeah.
Thank you, Doc. Thank you, Sir Sean. And of course, once again, thank you to our viewers. I just want to invite everybody next week, same day, Thursday, also 7:30 in the evening, we'll be having the topic Cancer Journey, Understanding Your Surgical Options together.
Oh, that's so good. Understanding surgery. Yeah.
Discussed by Dr. Jimmy Katapia. And of course, we will try to invite him again for an AMA portion. But of course, we'll still have our Dr. Jansen, Calalan, and of course, Sir Sean to answer our questions for that day. Once again, guys, please don't forget to follow all and like our Facebook page, Simply Nature International, and of course, our YouTube channel to keep you updated with all our online events here. Okay? Guys, your curiosity about your condition and your success stories in your cancer journeys and health journeys is what keeps us moving and pushing here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. Thanks, everybody. Good night, and God bless you all.